Before we jump into the episode, I want to thank our newest How I Doctor sponsor, Savaro. Savaro is a top telestroke and neurology company that was built to fix one of the most predictable failures in modern medicine, getting timely, consistent access to a neurologist when you actually need one. Their team of board-certified neurologists deliver rapid video response, clear decision-making support, and continuity from the first exam all the way through treatment planning and management. Hospitals working with Savaro see faster door-to-needle times, fewer transfers, and measurable improvements in patient outcomes. And because Savaro was built by physicians, the workflows actually match real-world medicine. If you need stronger, faster, and more predictable neurology coverage, visit savaro.com to learn more. And now, let's get into today's episode. Before we jump into the episode, I want to thank our sponsor, Evidently. Evidently is the clinical data intelligence platform built to help physicians harness the ocean of patient data they're drowning in every day. From chart summarization to AI-assisted note drafting and denial appeal support, Evidently makes sure the right data shows up at the right time. Physicians using Evidently report spending less time hunting through charts and more time focusing on patient care. That's why they've become a trusted partner to health systems looking to improve documentation, quality, and revenue sustainability. The company is led by providers and AI researchers that are dedicated to reducing documentation burden and helping clinicians practice at the top of their license. If you want to see what Evidently can do for your hospital or your practice, reach out today at www.evidently.com. Now, let's get into today's episode.
One of my favorite quotes from the book is that mis and disinformation grows in the dark, just like mold on bread. And we left this big black space open, and we didn't give actual scientists and doctors a voice. We didn't make it accessible to patients. And imagine if you can't get an appointment with a primary care doctor or a specialist for 6 to 9 months, Dr. TikTok is your doc.
Welcome to How I Doctor, where we're bringing joy back to medicine. Today, I'm joined by Dr. Geeta Nayyar, rheumatologist, former chief medical officer at Salesforce and AT&T, best-selling author of Dead Wrong. What makes Dr. G's perspective different, and why I think it matters for this conversation, is she isn't just a tech executive who happens to have an MD. She trained in rheumatology, a specialty where clinical judgment, nuance, and pattern recognition are really everything. Dr. Nayyar still teaches at the University of Miami and advises organizations like the AMA and the American Telemedicine Association, giving her a front row seat to how decisions in boardrooms are actually made and how they impact not just the boardroom, but the exam room. My hope is by the end of this episode, you'll have a new perspective on how technology fits in your own version of How I Doctor. Dr. G, welcome to How I Doctor.
Thank you so much for having me, Graham. I am honored to be on your podcast.
I want to start off just asking you about being a rheumatologist. You know, most of the physicians I talk to on the podcast, emergency medicine has overlap with almost all of them, but there's not a ton with rheumatology. I feel like rheumatology and infectious disease, you guys are the diagnostic sleuths of medicine. So I'm just kind of curious, how did you pick rheumatology as your specialty?
My story is actually a little bit wild. My mom has a very rare autoimmune disease, and she was actually misdiagnosed her whole life.
Wow.
I went into rheumatology largely inspired by that. And then when I was in my fellowship, my mom was actually dying.
Oh,
and
gosh.
I actually diagnosed my mom correctly and saved my mom's life. And my mom is now almost 80, lived to meet my daughter, has had a full amazing life. But a big part of the disconnect in my mom's case was the data, right? So a big part of how I put my mom's story together is I went through the painful process of getting all of her medical records.
Yeah, and this was pre-AI.
Yeah, pre-AI.
Yeah.
And literally laid it down on the floor. I remember locking myself in my parents' office, and I literally just put it all on the floor in chronological order. And I was like, okay, pulmonary did this, and then endocrine did this, and then cards did this, and then blah, 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 blah. And then after doing this for 10 hours, then I finally came out of the office and was like, oh my God, I think I know what's going on.
Wow.
And then I will tell you, even when I thought I knew what was going on, to get any of her doctors to entertain my diagnosis was a whole nother thing. And it was a real lesson in leadership. And everyone was sort of like, hey, kid, and I was 20 something years old. I was
Totally. Yeah.
pounds,
Yeah.
90. Like I was like this big trying to tell these guys who were like 30 years older than me with so much more experience than I knew what she had, which was this really rare thing. And they basically told me to go pound sand, right? They were like, "Kid,
Yeah.
really cute." So long and short of it, I got into several arguments with my mom's physicians, and I come from a South Asian family. We regard respect and age, and I just
Sure.
remember both of my parents being like, "You're such an embarrassment, and how dare you talk to these doctors like
Oh, that
this?"
you were pushing back was causing shame for them
Yeah, like
because
they were like,
they're a higher, more
right,
senior level of physician. Yeah.
of course, and they were like, "You're so disrespectful," and I was like, "I'm not disrespectful. I'm asking questions that nobody is answering or has good answers to." So long and short of it, I actually called my chairman. Amazing human, has a big call out in my book as a thank you and an acknowledgement, Dr. Katz. And I called Dr. Katz and I said, "Dr. Katz, no one here will take me seriously. I said, can I present my mom's case?" I presented the case and I said, "I think this is what's going on." And I said, can I bring her to GW? Would you see her there? And can we do the workup?" And he said, "Absolutely. Get on a plane and come." He's like, "I think you're right." And he saved my mom's life. And then he saved my mom's life because he believed me. But it really inspired not just my path in medicine, specifically my path in rheumatology, but also informed my path into tech. Because then afterwards, right, like now that health tech was starting and EHRs and all these things, and I was like, man, I mean, how many patients can have their kid become a rheumatologist or cardiologist, right, and figure out their kid? Like, it shouldn't take that, right? And so my takeaway is, what does the average family do? What does the average patient do? What is a person supposed to do to get a diagnosis and a treatment plan? And so that really also inspired my path into health tech because I saw the future of medicine about the data. I saw it as a data play. I saw it telemedicine. I saw all the things we see now, but I was again in my 20s at the time. And to me, it was this way to really democratize healthcare and improve healthcare.
What an incredible story. I mean, you gave me chills. It's just making me think so many more questions because rheumatology deals with primarily quite rare, quite uncommon diseases. And you often don't get to a rheumatologist until you've maybe gone through many other specialists, or at least a few, or a few trials of XYZ. How do you, honestly, as a rheumatologist, like, come up and make that determination between two very different paths? One is more treatment, more treatment, more treatment. The other is like, oh, we got to zoom back and go back to diagnosis.
So, it's a great question. And I think in rheumatology, because we are such an esoteric field, and now, treating patients who don't always fit in the box. I mean, this is the thing with connective tissue disease. We literally have a category called mixed connective tissue disease, which means we think you have a little bit of lupus, we think you have a
A
little bit,
catch-all.
right?
Yeah.
We think you got
Yeah.
something going on with the autoimmune system, but we actually don't know. We think it's a mix, a blend. So we actually have a category. And sometimes those diseases through time will declare themselves and be more lupus like or more RA like or not, right? And so in rheum, what I would say is that we always have a healthy appetite for a second opinion. We also have a healthy appetite when diagnosis is unclear or somehow vague or something has changed, right? To actually go back and revisit the diagnosis. And I think having a healthy appetite for approaching it with curiosity and also learning, right? And also just in our specific field, again, diagnoses sometimes change. And so I don't know if that's specific to rheumatology, but I do know it is something unique to our field. And it's really about the patient and are they getting better? Because if they're not getting better, and I will throw back a little bit to my mom's case. And when I looked at the neurology notes and I spoke with the neurologist, he had categorized her as pre-diabetic neuropathy. Sometimes you can actually get a pre-diabetic neuropathy. And I looked at all her labs. My mom is not a diabetic to this day. And I said, "You categorized her as pre-diabetic neuropathy. Neuropathy progressed for over a decade. She never developed diabetes. So what else was on the differential?"
Yeah.
And I just remember that specifically because this neurologist got really angry with me and was like, "You're really challenging me." And I said, "Well,
Yeah.
I mean, I'm looking at your notes for 10 years. This wasn't 2 weeks.
Right.
Like, if this was my patient," that really pissed him off, right? "This was my patient
Yeah.
that never got diabetes but kept being labeled as pre-diabetic in the chart. When do you want her to get diabetes? Like, what's the threshold for
Yeah.
pre-diabetes?" Like, it's been a decade.
Yeah.
She's not pre-diabetic, right? And like I said, she literally to this day does not have diabetes. So it was to me obvious, but I also understand seeing a patient for over a decade, someone being stable and then suddenly something changes and it does kind of, and that's where I think you say, I think you should get a second opinion. Maybe Graham will
Yeah.
just,
Oh, sure. Yeah.
because this is the first time you're seeing the patient. And anytime we see something with fresh pair of eyes, it's very different than when we've been looking at it, looking at the wall 10 for 10 years, right?
And just the idea of, keeping an open mind and, one of the diagnostic errors and heuristics is, premature diagnostic closure, right? You too quickly jump to, oh, this definitely has to be this, not that. And sometimes that's easy to do, right? I think that's the art of medicine, is knowing when to maybe know your limits, and also knowing when to be confident in a diagnosis and when to acknowledge, I'm honestly not sure what this is. Dr. G, I want to pivot a little bit to your book about misinformation, because I think it's actually a really fascinating parallel. Knowing what information to believe and hold as truth versus not truth, I think has gotten messier with social media and, frankly, worse access to accurate information. But at the same time, having a sense of like how to trust that your mom's information was correct. I mean, you got new biopsies because you weren't sure the first ones were correct. Like, what have you learned, and what were your takeaways about where the misinformation is coming from, and how doctors, patients can figure out what is trustworthy and what to believe or not believe?
Sure. It's a crazy time to be alive, right? Because on the one hand, it's
It is. It's incredible and it's terrifying.
right. It's such an exciting time if we look at all the technology out there. We look at AI, the limitless potential of AI. If we look at social media and how, it can connect us and in other ways it can separate us, right? Everything is operator dependent, as I say. And so I think it's important to acknowledge, at least in the health space, that mis and disinformation is really the issue of our time, right? Because it's not a new concept.
Yeah.
Mis and disinformation has been around since you and I have been in grade school, since way before
Yeah.
that, since the Black Plague, right? So this is not a new concept. But because of the era that we're living in, because of this era of innovation, because of the consumer era where everyone is curious about their health, everyone wants to live to be 100, right? No one's waking up saying, how can I be unhealthy? So we're living at a time where people are very dialed in to their health. And we're living at a time where information is just so overwhelming and rampant. And so what I would say is that it's important for us to acknowledge that as healthcare leaders, because in the past, I've always said mis and disinformation is like the beige, boring wallpaper in your hospital, my hospital, right? We know it's there. We know it's in the examining room with us, but we sort of just go about our business, see the patient, and move on. Because of today's environment, that wallpaper is now neon pink. It has become impossible for us to ignore, both as doctors, both as
Yeah.
patients. And if we as healthcare leaders don't address it, frankly, that's how we got here, right? It didn't become neon pink overnight. It's
Yep.
that when you think about your hospital, when I think about my hospital, what does every healthcare administrator say to us? If you post something on social media, you cannot mention your association with our hospital.
That's
That's
right.
on you. There's a liability. Make sure you have a disclaimer, right? Meanwhile, the misfits out there, the doctor on TikTok, the doctor of TikTok and Instagram, they can say whatever they want,
Yeah.
right? Because they have no responsibility. They have no liability. They have no professional reputation to maintain. They have no ownership of the information that they put out, right? Monday, get vaccinated. Tuesday, don't get vaccinated.
Wednesday, buy my supplement. Yeah.
Right. Wednesday, buy my supplement.
Yeah.
Thursday, it's the one hack, right, with castor oil. So I think it's really important to look at folks who have done the opposite, because I think that's the biggest opportunity for us as physician leaders and healthcare leaders. Look at Kaiser Permanente. Look at Cleveland Clinic. Look at Mayo Clinic. Kaiser recently launched a TikTok channel with all of their doctors. So it's a Kaiser
Yep.
channel. And they have their everyday GI doc on there. They have their everyday cardiologist on there. And they show them cooking and talking about these are the things you should eat. This is what we do every day. We
Yeah.
talk to our patients every day. But they gave them a platform, a Kaiser branded platform, right? They went through regulatory, they went through compliance. I just did grand rounds for them, so I know all of this. I said, how'd you do it? How'd you convince the lawyers? How'd
Yeah.
you convince the... And they said, you know what? We made the case. We made the case that that's where our patients are at. And our patients would prefer to follow us, Graham, right? But we as a healthcare industry have left this huge vacuum open.
It is. It's a vacuum and a void. I was just going to say that. I totally feel that. Yeah.
Yep. And then one of my favorite quotes from the book is that mis and disinformation grows in the dark, just like mold on bread. And we left this big black space open, and we didn't give actual scientists and doctors a voice. We didn't make it accessible to patients. And imagine if you can't get an appointment with a primary care doctor or a specialist for 6 to 9 months, Dr. TikTok is your doc.
I want to take a moment to thank our sponsor, Savaro. If you've ever waited and waited for a neurologist to call you back, you know the problem that Savaro was built to fix. Savaro is a physician-led telestroke and neurology company that delivers rapid virtual neurology coverage that's reliable. Their board-certified neurologists connect by video in under 45 seconds, and they stay with you through the entire decision-making journey. Hospitals working with Savaro report faster door-to-needle times, fewer unnecessary transfers, and measurable improvements in patient outcomes. If your hospital needs stronger, faster, more consistent neurology coverage, visit Savaro.com to learn more. A quick word about today's sponsor, Evidently. Their platform turns an ocean of fragmented clinical data into concise, actionable insights. Chart summaries, note drafting, denial appeal support, HCC capture, so you spend time caring, not chasing. A transplant surgeon at a large academic medical center recently took transplant referral review from 2 hours to 20 minutes with AI-assisted chart review from Evidently. Physicians deserve workflows that improve accuracy, reduce exhausting chart biopsy, and help us practice at the top of our license. If you want to see how this might work in your hospital or your department, go to evidently.com. That's evidently.com to get started today. I think that's the other huge piece of this is when you're sitting around with 6 weeks of fatigue or weight loss or abdominal pain, and it's 8 weeks to get in to see your primary care doctor, and the only alternative is spend $10,000 to come to the ER. Of course, people are going to try to find some alternative way to understand what could be going on with their body or what a solution might be. And what do you know? TikTok and Instagram have plenty of people who will tell you exactly why you're fatigued and will sell you a solution as well without knowing anything about you. But they're extremely confident in their ability to fix you.
Sure. And the algorithms certainly know exactly who you are. And that's why you're reading their information and have a bent towards whatever political leaning, have a bent towards being vegan or not vegan, or whatever your cultural, religious background might be. So I think the flip is really important. One, that healthcare leaders take control. I applaud your podcast and you also giving docs and healthcare leaders a voice. We need more of that. Number one, we need our hospitals to work with us, not against us, right? We need to, as providers, take the microphone, literally take the microphone, get the blessing to do that. And it will also elevate the brand of the hospital. Shocker. You are credentialed. It is actually a win-win. These are docs that you have in your organization seeing patients. There's no reason to be so afraid, I think. And this next generation of doctors is even better at this stuff than we are. And then we need to educate consumers. We need to say consumers just, what is health literacy in today's age? Looking at the source. Is the doctor a doctor? Can you find an NPI? Can you find a place to make an appointment? And look, we all love entertainment. But that's not where I go to find out information about my health. That's where I go for entertainment. And so educating our consumers on, hey, if you love a podcaster, you love a certain celebrity, have at it. But for healthcare conversations, these are the 3 docs I follow. These are the 3 docs you should follow, right? Here's the patient association on, the Lupus Foundation. These are the places we need to start being more proactive in those conversations with our patients of saying, I know it's hard to get an appointment with me. You were lucky, maybe we were lucky to have this conversation. So here's where I want you to go. I want you to be informed. It's not that I don't want you to be informed, but I want you to know what you're reading is actually sound and that you don't come in more confused and then more afraid of actual treatments, which is really what's happening a lot, right?
Yeah, I had Dr. Fran, she's an OB-GYN on the podcast. And, she said that she actually makes more money from TikTok than she does from practicing OB-GYN now. But she said that what she really enjoys about doing social media is, like you said, getting accurate information out there. We have to do it. We as a profession have to do it because otherwise that void will be filled by people who don't know what they're talking about. So many of her posts and TikToks are really this is crazy, but like what she doesn't have time to tell her patients in a 15-minute encounter. So I thought that was such a great framing of like what to post on TikTok. Post the stuff that you wish you had 2 more minutes to tell your patients.
I love that, but I also think that's a space for the enterprise, right? The
Yeah,
hospital should
sure.
really, because I speak a lot to hospital executives as well, and hospital boards, and I say that to them. Your job is, understanding that all of the confusion around vaccines continue to be confusing. The pediatrician should be able to turn to you as the hospital leadership and say, "Give me the sources. Give me the place that our hospital produces content so I can say to my patients, you're having a new baby? Here's what I want you to read."
Yeah.
Cleveland Clinic, Mayo Clinic, they have been actually doing this long before everybody else. Cleveland Clinic, I actually speak about them in chapter 8 of the book. Amazing chief marketing officer, reached out to YouTube long before anyone did and really used his doctors, his staff in partnership with the chief medical officer and just blasted content out, attached a telemedicine program to it as well, became a revenue generator, not a cost center, and really just said, we are going to own the narrative. This is what we do every day. We are in the business of who better than us for our patients to turn to. And I think that kind of leadership, that kind of understanding of where technology can be an asset is really critical.
Your book came out, I think, in 2023. Misinformation has a new, almost a new flavor, or it's accelerated in some way just with AI and slop. And, I certainly see both sides of generative AI. I see the incredible ability to scale and provide really good information to people. And I also see the ability to generate slop and generate misinformation and disinformation with bad actors as well. So, has generative AI made you think any differently about what you wrote in the book?
Sure. So just to clarify, new edition of the book came out last year. So I did
Oh,
update.
amazing.
But what I would say, and what really changed very quickly, right? What changed very quickly from first edition to the second edition in my book is really that mis and disinformation now, it used to be on the fringe, right? It used to be sort of the end of the bell curve. It was on the fringe. It was those folks on the spectrum of one extreme or the other that were really the purveyors and source of mis and disinformation. What has changed now is that mis and disinformation has gone mainstream. It is now in the halls of power. It has become legitimized. It has clearly become monetized. It has become politicized, right? It is getting incredibly powerful and it is incredibly lucrative to spread mis and disinformation. And I think that's the second piece that, again, the everyday consumer and physician needs to know. You just said it. Dr. Fran makes more money on TikTok than in her practice. So it tells you that content is king and that algorithms are built on engagement. And the more provocative, the better. Right. And so finding authentic information and understanding that is really critical, but really asking the question of who benefits when I click here? Who, when I subscribe, right? Is there an advertisement? Is there a credit card that I have to pull out? Like these basic things are going to be more and more important in the era of generative AI because it's so good. It's so good. And you know what? Confidence is not accuracy. That's the other thing I want to say, right? Because
Yes.
with generative AI, man, they know how to say it to
They are
Fran
so
Walker.
confident.
But
Yeah.
they are so like a smooth talker, right? Like I tell my daughters like stranger danger. It's like stranger danger on social media. You got to know that they know how to talk to you. They know everything about you based on the algorithms, but they're just because they're confident, right? One hack that will get you to 100 gram, right, is those green jelly beans that I sell only here for $5.99. Click here, right? You got to pause. You got to pause and you got to say, man, why is it when my doctor talks, it's so complicated, but this influencer makes it sound so easy, right? And I think that's one of the things we do have going against us as docs is because
There's
science
nuance. It's subtle. It's complicated.
science
Yeah.
has
Yeah.
it takes us 30 years to get trained, right? I wish there was a silver bullet to everything. I wish there was a one size fits all. We already talked about it. I can tell you in rheumatology, there is no one size fits all. That is the whole art of medicine. That's kind of the whole deal. And so you have to have enough knowledge to understand that generally it's not that simple, just like mama said, right? There's no free lunch and that you have to understand that science is complicated. Chronic disease is complicated. So when someone makes it sound so easy and so simple, there's generally a catch, right? And the flip side of that for us as doctors and healthcare leaders is we got to keep it simple, Sally. When we can make it simple, when we can articulate third grade level and lower. We need to. We need to start doing that. We need to get our docs on TikTok. We need our hospitals to support us, our communities to support us. And we got to take it offline. It's not all online. It's in churches, it's in barbershops, it's at the park, right? And so recognizing that trust and those circles of trust are multifaceted and making sure that we are right there, right there with us. And here's the thing, it's one of those rare occasions where good business and doing the right thing and the good thing can also be lucrative, right? Because if you do that, you will have a budding practice. You will have a budding stance in the community. You will become the de facto expert for XYZ disease or area of expertise. And so it is very much a win-win when done correctly from a business standpoint.
Yeah. I mean, I would love to see more alignment and partnership between, hospitals and physicians who want to provide good information out there. Like, what do you think the right relationship is? How do you think the frontline physician can make the right pitch that will be acceptable, aligned with maybe the hospital leadership, but allow them to have a little bit of voice and give this a try?
You bet. So first of all, I think it's more than hospitals. I think it's everyone. I think it's payers, providers, pharma, life science, med tech, all of us, because we're all on the same team, right? So I think it actually starts with the chief medical officer, right? If you're an everyday doc working on the front lines, I think you got to introduce yourself to the CMO at your hospital. I think you got to say, look, every day I get a patient that comes in and says, I did my own research. This is what I need to prescribe, right? The patient's coming in with what they need from you, and they're very specific and they're not interested in anything else, right? So having that conversation with the CMO saying, I need more help. I need more support from the hospital, whether that's going to be a content channel, whether it's permission to have my own content channel. And it's something I can bake into my practice of, hey, I want you to watch these 3 videos because you have a new diagnosis of lupus, RA, whatever it might be. So that's one. And then I think, listen, the hospitals are in the same boat. When you look at crisis comms things that have come at hospitals because of said podcaster, there was a situation in Denver where a very influential podcaster, the accusation that the hospital was spreading Ebola
Wow.
when they were getting ready for an Ebola. There was data showing that there was going to be an Ebola outbreak, and they were actually vaccinating the staff. And it turned very quickly into a PR nightmare for the hospital
Sure.
that came out of left field. That actually distracted them from care and cost a lot of money and time to the hospital. That was so out of left field, right? And so hospitals are starting to realize this too, that they have all these influencers online that they're competing with now, right? They're now competing with, because guess what all those influencers are saying? They're saying, don't trust the hospital.
Yep.
Don't trust the establishment. Don't
They want to
trust.
keep you sick. They have an
They,
incentive to keep you
right.
sick. Yeah. Yeah.
That's right. And so the hospital has this kind of new invisible competition that they didn't have before, because before it was the hospital down the street, it was the doctor down the street. Now they're like, man, these people are owning our patients. And by the time they get to the hospital, it's so late. It's too late in many cases, right? And the other piece to this, which we haven't talked about, is telemedicine. Because, hey, we have an access problem. We have a shortage problem. We have a burnout problem. I'm a rheumatologist. I can't tell you the number of people, even on Instagram, TikTok, that want an appointment with me, and I don't have a
Oh,
driving.
I can't imagine what the wait time is to see a rheumatologist in this
It's
country. Yeah. Yeah.
terrible everywhere, like every specialist and like primary. So when you make these apertures available online, if you couple that with the telemedicine strategy, again, revenue generator. Take the playbook from Cleveland Clinic and my book. They were like, hey, this connects us to patients. This connects us to revenue. This is faster for our doctors, faster for our patients. So being really strategic, this isn't a moral imperative. This is a business case. I really went out my way in the book to talk about the financial importance to the battle of mis and disinformation. And when you are a payer, look at the pharma companies now, right? You got a vaccine. Who's going to get vaccinated? There is a war of information around vaccines right now. So everyone is on the same side here, but it really is one of those rare cases where doing the right thing, saying the right thing is actually the more lucrative option.
Dr. G, in our last few minutes here, I think people listening to this probably would be jealous, feel like it's incredible that you get to talk to C-suites and have that access, and that you've led non-medical companies with their medical strategy as well. What's maybe a non-obvious piece of advice you can give to anybody that wants to follow in your footsteps or have a career that is a mixture of clinical medicine and a CMO to a tech company or an advisor to a startup. What did you have to learn the hard way that maybe other physician listeners could benefit from?
What I would say is that mentors, right? So much. And you know this too, even in medicine, you're building practice, you're figuring out, technology. It's always your peers. It's always our peers. I mean, it's what you do on this podcast, right? It's always the information from peers. It's not finding it on ChatGPT, Perplexity. You're not going to find it online. You're not going to find it in a class. If you want the real deal, it's talking to mentors. And I just spoke to so many people in different fields. I thought I wanted to do policy at one point. I talked to a bunch of doctors doing policy stuff. I realized it was very boring. Policy was not for me. It took too long.
Yeah.
I'm someone with a lot of patience. My husband can attest to that, right? And I got to have an impact now.
Yeah.
If it's going to take 10 years, that field is not for me, right? So, but I learned that from talking to peers, right? I learned that and understood that from talking to peers. At one point, I thought I wanted to do academics. I talked to a bunch of academic docs, spent time in the lab, doing research, and the same thing. I was like, man, this is just so technical.
Yeah.
And stuff doesn't come to fruition. Too slow for me, right? And so, like that, you got to have mentors. And if you aspire to be someone, if, whoever it might be inspires you, start at your own organization. So if you are at a hospital, if you are in a system, there will be any number of people in the directory, any number of people in the C-suite leadership on the board. Set up an appointment and make it easy, Graham. 15-minute coffee. Could you take 15 minutes to meet me for a coffee, ideally in person, if not a 15-minute Zoom, and just listen and ask that person to talk about themselves? That's it. And you will be so surprised that by the end of that call, that person is your bestie. They've shared stuff with you because it's like, wow, this person, it's who doesn't want to talk about themselves? I mean,
I was just going to say, everybody loves to talk about themselves.
right.
Yeah.
It's a compliment that you will
Yeah,
be
right.
surprised that people will give you a meeting. Don't make it difficult. Don't ask for an hour. Don't ask for it to be lunch, right? Like make it easy because you're asking.
Get your foot in the door.
And then the last thing I would say is, and pay it forward. Right? Pay it forward because the day of
Yes.
tomorrow, it is a small world, it is a small community, and it doesn't take much to also make 15 minutes of your time available to somebody who is looking to do what you're doing. So I would say to keep that karma.
Yep.
I very much believe in karma, and you'll be surprised how it comes back and supports you.
In spades, yeah. Dr. Geeta Nayyar, it has been an absolute pleasure. I was so happy to get to talk with you today.
Likewise. Thank you so much for having me.
Thanks for joining me today. For interviews with physicians creating meaningful change, check out offcall.com/podcast. You can find How I Doctor on Apple, Spotify, or wherever you listen to podcasts. We'll have new episodes weekly. This has been and continues to be Dr. Graham Walker. Stay well, stay inspired, and practice with purpose.